Hello, everyone. My name is David Hazimi. I am an emergency room nurse. I am here to talk about the pediatric population, their home medication, and their non-compliance. Achieving an accurate and timely dosing requires informed participation of the child's caregiver and, to the extent possible, active involvement of the child as well. Effective education is critical. The following issues should be addressed: dosage, size, and timing, route and technique of administration, duration of treatment, drug storage, the nature and time course of desired responses, the nature and time course of adverse responses. Asthma exacerbation are the leading cause of hospitalization in children and a leading cause of potentially preventable pediatric admissions. Despite reductions in the rate of potentially preventable pediatric asthma, admissions between 2003 and 2012, asthma hospitalizations remain high in certain populations and account for almost one-third of childhood asthma costs, resulting in $1.5 billion in hospital charges annually in the U.S. as hospital and health systems take on increasing risk in their contracts with insurance companies. They face increasing financial pressure to reduce rates of readmissions. Children hospitalized for asthma have approximately a 20% chance of repeat hospitalizations in the subsequent year, and 3 months readmission rates vary widely among hospitals, ranging from 3% to 14%. With this increased risk and wide variation in outcome, children hospitalized for asthma are an important population on which hospitals and health systems should focus. There is an ongoing debate regarding how much inpatient management and discharge planning influence asthma readmission rates and whether readmission rates are truly a measure of high inpatient quality care. The Teach Back process is a comprehensive interdisciplinary evidence-based strategy which can empower nursing staff to verify understanding, correct inaccurate information, and reinforce medication teaching, a new home care skills with patients and families. The evidence-based practice fellows at Children's Hospital of Wisconsin designed and implemented an educational intervention for nurses on Teach Back, which encouraged nurses to check for patients and caregivers' understanding of discharge instructions prior to discharge. Written instructions should be provided for techniques of administration that are difficult. A demonstration should be made, after which the caregivers should repeat the procedures to ensure they understand. With young children, spills and spitting out are common causes for inaccurate dosing. Caregivers should be taught to estimate the amount of drug lost and to re-administer that amount, being careful not to overcompensate. Additionally, additional ways to promote adherence include selecting the most convenient dosage, form, and dosing schedule, suggesting mixing oral drugs with food or juice when allowed to improve palatability, providing a calibrated medicine spoon or syringe for measuring liquid formulations, and taking extra time with parents to help ensure constituents and skilled participation. This is my reference page. Thank you for listening.